Doctors of Reddit, what's the biggest case of faking it you've ever seen? Young, 18 to 20, woman went running into small rural hospital ER pretending to have abdominal pain. Police officer had tagged her going 40+ km over the limit, which was stunt driving as per the new law in Ontario, impound and license suspension automatic. Cop followed her into ER and apparently said he'd be waiting for her when she left. Locum staff such as myself were housed at a small B&B about 15 minutes away, and the ER had pre-printed order sets to be done before we arrived. When I arrived, she flat out admitted that she just came in because she freaked out and didn't stop. I told her we'd give her 45 minutes to call her parents/family before I booted her. Except, BHCG came back positive, and subsequent ultrasound came back showing extremely early ectopic. Officer figures out something is up when he hears air ambulance call come in over radio. She was completely asymptomatic and just worked out that she dodged both charges in a life-threatening issue by accident. It was definitely a WTF moment. Edit, well, this blew up overnight. I got a few messages. A little more info. Small rural hospitals in northern Ontario often service areas from more than an hour's drive away and still only have a catchment area of 2,000 to 3,000 people. When on call, it was just that, we would do our days in the community clinic, then maybe hospital rounds, then go home and be on call. We wouldn't be at the hospital. There wasn't an on-call room where you would stay, for example. There were lots of times that you'd go a full night without being woken up, or maybe just a call from the acute care inpatient wing. Locums were short-term contracts for places that didn't have full-time medical staff for whatever reason. It's hard to attract clinicians if you don't even have broadband internet in the community. They generally pay very well. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests, didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk. So I update them saying everything is fine, tests are negative, you can go home. Patient gets up, gets dressed and walks out without a word. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. That's the best part about most of these stories, when they make up some form of fake machine so that the patient stops faking. Cracks me up every time. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking, tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh, and of course his eyes were back to normal and focused. One time my roommate, who is an ICU nurse, came to see one of my indoor soccer games. During the game, a player on the other team went down hurt and starting screaming in pain and swearing and rolling around while holding his ankle before he was eventually helped off the field. He then limped over to where the fans sat and watched the rest of the game brooding in silence before he left early. After the game, my roommate told me he was going to go over and see if there was anything he could do to help, until he saw that the guy was limping on the wrong leg. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot. Wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk. Hips swaying, full stride, going places. We were all fools. To what end did she fake an injury? Sympathy? You guys don't prescribe, right? No, but my money would be on trying for some 7-figure lawsuit payout, which involves playing the long game. Amateurs, for a 7-figure lawsuit, you even limp in the shower. That limp would become part of me. I had a patient when I worked in an ICU that was sedated and on a vent. A family member showed up out of nowhere and was staying day and night. I got pretty suspicious of them because they were clearly lying about knowing this person. Just talked to the fake family member about how it must have been sad since they just celebrated their birthday a week or so before getting ill. This person said it was a wonderful party and such, to which I replied their birthday hadn't occurred yet and wouldn't for months. Turned out when security came, it was a homeless person who snuck in and found a room with a sedated patient and decided to make it a place to stay. Needless to say, security to enter the ICU was absolute shit. I am a nurse but not a doctor. I had a patient who worked in a hospital, janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, wanting morphine. He was worked up for everything cardiac and was fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything. Faked chest pain again. Cleared again. Now he's my patient. I'm a new face. He's telling me he's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomach ache. I decide to go to lunch. My coworker comes into the lunchroom, disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he'd had fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of shit in a puddle of ginger ale. I told him I'd have to take away his food and drinks and we'd have to put an NG down. Suddenly he changed his tune. He admitted to faking it. Why do these people do what they do? In the story, opioids. ER nurse. Bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with the specimen cup that literally has a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumb ass back to the waiting room to contemplate his stupidity. My next door neighbor would drink a 12-pack of Mountain Dew a day and keep kidney stones year-round to get pills. He had a pretty sweet deal too, getting 90 Loracets, 90 Xanax and 90 something else, I forget, every month from his doctor. He just couldn't stop doing other drugs and pissing dirty. I tell this story just because I was impressed with his determination to hurt himself and get surgery once a year just to get high. Like, the absolute determination that takes. My mother is a recovering addict and had been getting the same pills around that time and I don't recall her intentionally hurting herself. She just went with already messed up issues before she got herself into a clinic to get clean. This patient comes in for back pain with weakness of the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. Patient is infuriated that they're being discharged. Yelling and screaming about how they aren't better, how they're disappointed in the institution, blah blah blah. They said one particular thing that still clearly stands out 3 to 4 years later. I can't believe you are sending me home already. I haven't even told my family I'm here, and now you are going to send me home before they even have the chance to see me. My attending and I leave the room to arrange things with the nurses. We go back in and the patient is out of bed and standing up in the middle of the room. Miraculously the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding abuse of medical services. Not a doctor, but am a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did came back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest and knew we wouldn't admit her to hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. Edit. So this got a lot more attention than I ever expected. There's a lot of questions regarding birth control and questioning her parenting, so thought it best to add an edit. This patient was not by any means a benefits seeker. They were a hard-working and loving family that had full-time jobs. She had been booked in to have her tubes tied but found out a week before the procedure that she was pregnant with this baby. She just couldn't cope during the pregnancy, and became very mentally unwell. She did not realize the implications or understand the face that she was causing massive harm to herself and her baby. She was referred to our perinatal mental health team and treated for psychosis. They also had a lot of input after she had her baby. She ended up having a C-section and was sterilized at the same time at her request. By all accounts she is doing very well now. Also thank you very much for the slivers. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up to but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. A friend of mine likes to stick out her hand for a handshake when people come in feigning blindness. Nearly all of them instinctively meet her handshake. It's great to watch. Edit. I am very much aware of the different types of visual deficits, thanks for your concern. How often does that happen? What is the patient trying to achieve? Not a doctor, but I was in the ER one night and there was a seeking drug addict who literally only acted in pain when there was staff around. You ever see those videos where the little kid is fine and then they spot a parent and then bawl, then immediately stop and be fine when the parent is out of view? Exactly like that. Set fine, no movements or wincing or noises, then wailing when a nurse was in the same vicinity, then back to fine when they left.